Well, a small hospital in Greensburg has launched technology that allows doctors to monitor patients at home, including those with COVID-19 who don't need the full support of a hospital setting. Business of Health reporter Kylie Valletta has details. Kylie.
Well, thank you, Gary. The new system uses a medical device that clips to the patient's finger to collect their vitals and the comfort of their home, and it sends that information back to the clinicians at the hospital. Called Massimo Safety Net, the device is made by a California-based company, and it's the major piece of a recent upgrade at Decatur County Memorial Hospital to their patient monitoring system. Here to tell us more about how it's being used at the hospital and at home is Rex McKinney, the President and Chief Executive Officer of Decatur County Memorial Hospital. Rex, thanks for being on the show today.
Thank you, Kylie.
All right, we'll get to the device in just a minute, but first, take us back to the early days of the pandemic. Decatur County had one of the highest COVID positive rates per capita in the state. Explain how that really underscored the importance of being able to remotely monitor patients.
Yeah, even prior to the impact of COVID in our community, our leadership team was really exploring a different platform from a patient care monitoring standpoint. We had some needs in the inpatient environment, and we really wanted a platform that would accommodate our inpatient environment, but also with an eye on the future with regards to the needs from an ambulatory standpoint, or those patients do not need to be treated in the hospital, but need to be monitored remotely in some fashion. Little did we know, just a couple months later after implementation of the initial platform, that the demand would be great from a ambulatory monitoring standpoint. So the impact of COVID, as we've seen, as that virus has evolved in the clinical conditions, some patients do not require admission, but need to be monitored very closely due to some other medical issues that they may have, some comorbidities that they may have that could really impact them clinically in a somewhat urgent fashion. So we really felt like there were some additional tools necessary for our physicians and providers to have available from a remote monitoring standpoint. So the Massimo platform proved to be very beneficial, both on the inpatient side, but also equipping our organization to accommodate the ambulatory environment from a remote patient monitoring standpoint.
Okay, so it's called the Massimo Safety Net. Explain the basics of how it works, both at the hospital and also patients that you send home with it.
Yeah, so there's a traditional bedside monitor capabilities. So we place these Massimo devices at every bedside in our inpatient environment. And it's some great technology that monitors a variety of vital signs. So it takes a workload burden off of our clinical and our nursing staff, and allows the nursing staff to improve the workflow at the bedside by integrating those vital signs into our electronic health record. So once a nurse sees the vital signs, takes the vital signs, she can simply push a button, download that data into our electronic health record, which frees up the nurse to spend more time at the bedside. There's also a central monitoring station where if our clinical staff is busy, they can be monitored centrally with alarms set for appropriate parameters. On the ambulatory side, we've seen some great benefit with regards to individuals that need to be monitored closely by our clinical staff. They can be monitored in live time, or we've used it in a method where it can be utilized to trend data. For example, one of our most recent use cases, we had an individual who had COVID, tested positive for COVID. Our physician was a little concerned because the patient was pregnant also. So the physician ordered a monitoring device to be placed on the patient so we could trend that data over time, so the individual, if in case the individual did deteriorate, our clinicians could identify that, reach out to the patient, and assess via the phone. And I have a sample of the device on my wrist right now, which is a very simple device that connects remotely to a mobile device, and that data is transmitted from the mobile device to our central monitoring station where our qualified nursing staff, or in physicians can take a look at that data and assess remotely.
Okay, and you're a critical access hospital, so you serve rural areas. And you talked off camera about how this is a win for the local community, and it really demonstrates how they can get great care, great technology close to home. Can you talk about that just a little bit?
Absolutely. For rural health environments like Decatur County Memorial Hospital, we are totally committed to serving our community. And to serve our community effectively, we need access to great technology and great care. Technology is so important. So to be able to implement this technology in our environment, Decatur County region, we serve approximately 26,000 individuals in our immediate county, and some of them are in remote areas. So that infrastructure around broadband is becoming increasingly important in the healthcare space. So we're pleased to be able to enhance our technology to monitor remotely, but also invest in the technology for the inpatient needs here within the hospital. So we're very pleased that we're able to invest in this technology, have the latest and greatest technology available for our clinicians and physicians, but also for those individuals in our community that require a little more close monitoring.
So you mentioned the broadband capability and how some of your residents are in remote rural areas. So is that a barrier? Do some of them not have broadband, so they're not able to use this device?
Yes, in some parts of our county, broadband access is a challenge. So we have reached out to our local broadband provider, and we are actually working with them very closely to invest in some technology that will enhance the broadband capabilities in certain remote areas of our county. So that is a real challenge for the state of Indiana as well as nationally for rural health providers. So we're very pleased at Decatur County Memorial Hospital we're able to invest in that type of technology to enhance the broadband capabilities of our region to ensure that individuals have great access to care via remote technology.
And much of this upgrade was paid for with a grant, correct? Given, I think, right in the thick of the pandemic as well.
Yeah, we were so blessed to receive an FCC grant of nearly $700,000 to enhance our telehealth capabilities. So yes, some of the remote monitoring investment did come from those dollars. We've also invested in additional technology that will allow us to provide remote clinic capabilities. We really feel like we can provide greater access to care for our local employers and help drive down local employer healthcare costs by reducing the time away from work for clinic visits and that sort of thing. So we're very pleased that we've been able to make a significant investment in telehealth technology as well as remote monitoring technologies to improve the health and wellness of our entire community.
All right, Rex. Well, congratulations on the upgrade. Rex McKinney, President and CEO of Decatur County Memorial Hospital. Thanks again for being on the show today.
Yeah, thank you.
Gary, back to you.
Great story. Thanks very much.